Hi everyone, Lucie Shanahan, Executive Director for the Public Health Unit with Albury Wodonga Health. We thought it'd be a good opportunity to give you a quick update about what we know is happening across the northeast region and particularly in Wangaratta following the emergence of 10 new public exposure sites in Wangaratta in the last day or so. We are aware, as I'm sure many of you are, that a person presented to North East Health Wangaratta Emergency Department and during their presentation to the Emergency Department has been diagnosed as a COVID positive person. That person has subsequently been transferred to Melbourne for ongoing care. The person, however, was infectious, we think, for a couple of days in the Wangaratta community, and as a result of that we've identified 10 public exposure sites, the details of which are now available on the Victorian Government Health Coronavirus Exposure website, and we're asking anyone who was at any of those sites in the time specified to come forward for testing. North East Health Wangaratta have expanded their testing capacity today and opened a second site in Wangaratta because we are expecting a pretty strong community response. We really do encourage you, if you are at any of those sites during the period, to come forward and get tested. And if you're symptomatic at all for cold and flu-like symptoms, please come forward and get tested. This is the best way that we can get a pretty quick handle on what's happening across the community and if we do have any further virus spread or infections across the community. The Albury Wodonga Public Health Unit is leading the public health response to this case, and the team are really busy at the moment contact tracing, looking at exposure sites and assessing the risk that exists to the community across the course of today. If any new exposure sites do become available, we'll make sure that these are listed on the Victorian Government Health Exposure Site website as quickly as possible. It's worth mentioning though that it does take us a few hours to work through the site, to interview people who are at the site, to gather any footage or information that we might need to help us make the assessment of the risk that sits at the site. And so there is a bit of work that goes in behind the scenes to make sure that we're making the best possible assessment and providing the best possible information to the community. So please bear with us as we work through this over the coming days. We're aware that just as we saw last week, that a number of businesses are making the choice and taking the action to close and to clean their sites if they have been advised that they are an exposure site. We certainly do endeavour to get in touch with sites really quickly to let them know that they may be an exposure site, but there is a time lag between this information becoming available and us completing our assessment and getting the information up on the website, the Department of Health website. So again, for any public exposure sites, if you have been there during the time or if you're at all symptomatic, please come forward and get tested. The last thing I'd like to do is encourage as many people as possible to come forward for vaccination. We do have a good vaccine supply across our vaccination network in North East Victoria at the moment, and if you have your first appointment booked or if you need your second appointment, please do jump in, make your appointment and come forward for a vaccination. We know that this is one of our best lines of defence and we encourage you all to come forward and do so. As information comes to light and if any further updates are required, we'll be sure to jump on here and let you know anything that you may need to know as quickly as possible. Our Public Health Unit is working really closely with North East Health Wangaratta, and between our two services and organisations, we will get the information to you as quickly as we can. Thanks for everyone for tuning in. Thanks for your considered response at this time. Please keep yourself safe and we'll be back in touch soon.